2, 1.
Hello, welcome and good evening. I'm really pleased that you can join us this evening to talk about the COVID-19 vaccination program for children and young people. It is a very important topic, and this evening I hope you will leave feeling a little bit more informed or with a bit more information than what you had before. So please stay with us. We have a really interesting lineup of experts on the panel, and we will aim to try and answer as many of your questions as we can this evening. So just to introduce the expert panel that we have today, my name is Shannon Cotillo, and I'm the Director of Public Health for the London Borough of Wandsworth. But we're also really delighted to have Dr. Caroline Scott, who is a local GP in Wandsworth and also a vaccine lead in primary care. We're also really delighted to have Sadina Agama, who is the Chief Pharmacist in Southwest London for the CCG. And last but definitely not least, we've got Una Dalton, who is the Program Director for both the COVID-19 and flu vaccination programs in Southwest London. So just to go over the aim of the session and the agenda this evening, obviously this event has been designed with you in mind. It's an opportunity really for us to share the latest information that we have about the vaccination program, COVID-19 for children and young people, but also to mostly provide you with an opportunity to answer the questions that you have. So what we're going to do is start off by doing a little bit of housekeeping, because obviously we're doing this remotely and digitally, so it would be good to just cover a few points in terms of how things will work tonight. And then you will have some very short, brief presentations from some of our panel members before you finally have the opportunity to participate in the question and answer section. Now, obviously, don't wait until the end of the session before you start answering your questions. As our presenters are speaking, if you've got things that you want to find out a little bit more about, please start putting them into the chat straight away. So in terms of the housekeeping, the first thing is, because this is a recorded webinar, which we will be able to share on the CCG's website, on the NHS website, and on the council's website, it means that only the webinar chair, myself, and our panelists will be visible on camera. As attendees, you will not be able to turn your cameras on. That function has been disabled for you in advance. The questions that you can ask can only be asked through the chat function that we have. So please put your questions in the chat box as you think of them, and we'll try to answer as many of them as we can before the end of the evening. It may be the case that we'll have a lot of repeated questions or more questions than we can answer. So what we'll try and do on occasion is to try and bring some of those questions together if they're around a general topic, so we can try and address them in one go. And obviously, at the end of the session, we'll be able to share with you a link to Southwest London CCG's Q&A page, where some other questions have already been answered that other people have asked us. And as I say, any questions that we can't answer this evening, we'll take them away, follow them up, and update the Q&As which are on the CCG website. So firstly, I'd like to call upon Una Dalton. Una, can you tell us about the school immunization program, how that works, and a bit around the consenting process?
Great, thank you. Nice to see everybody this evening. As you all know, as part of the national rollout of the vaccination programme, the Chief Medical Officer has recommended that all young people aged between 12 and 15 should receive a first dose of the COVID vaccine. We've been running this programme now for this cohort for about 5 to 6 weeks across Southwest London. The aim of it is to protect young people from COVID, which is a serious illness, to reduce outbreaks that occur in school and keep children in school for as long as possible, and overall to protect friends and families against this virus. In Wandsworth and indeed across southwest London, vaccinations have been taking place consistent with all of the other vaccination programmes that would usually take place in schools. Additionally, since half term, we've also opened up vaccinations at our mass vaccination centres across southwest London, where you can walk in or you can book an appointment using the national booking system, and you just need to use Google and search for COVID national booking system, and that will come up. We have put in place alternative arrangements for those who are homeschooled and those in secure services or specialist mental health settings. Thank you. So we've got this programme, which is successfully running at the moment in nearly 200 schools in Wandsworth and across southwest London. In terms of the process that's happening for parents, they will receive a letter from the local school immunisation service. In Wandsworth, that is Hounslow Enrichment Community Healthcare. With a letter which sets out when the vaccination will be offered. It provides some background information to the vaccination programme and useful links. Parents or guardians of children are then asked to provide consent through an online form. They will also be provided with a contact number should they have any questions or queries about that school-based service. Parents are asked to return the consent forms by the agreed deadline so that the team can organise vaccination on site at the school. Another way to receive the vaccine is for young people to either visit a 12 to 15-year-old clinic at either Roehampton, or as we said, they can ring 119, or they can go onto the CCG website and look at any of the mass vaccination centres across southwest London, where we have specified clinics for this particular cohort. Thank you.
Thank you very much, Una. So there you have it from Una. The vaccination programme in the schools is well underway, with some schools already having had an initial visit, but that's not the only opportunity for your child to get the vaccine, because you can see we've got walk-in centres and other opportunities for them to get that vaccine. And thank you very much to the people who are watching at the moment. I can see that questions have started to come through, so please do keep the questions coming through as we go through our panel presentations. So next, I'm really delighted to invite Caroline Scott, Dr. Caroline Scott, to tell us a little bit about consenting and the importance of vaccinating children. Caroline.
Thanks, Shannon. So yes, I'm Dr. Caroline Scott. I'm a GP in Wandsworth, and I've been asked to touch on two main points this evening. So the first one is really around consent for vaccination, or making a decision about vaccination. As we've already heard, parents will be contacted with information about the vaccination programme, and included in that information there is a leaflet which you'll note is actually addressed to your child because they're the one receiving the vaccine. But really, we would encourage this to be a family discussion, a discussion at home to make that decision, and that parents are being asked to provide consent via the link on the letter that they will receive. In the unusual circumstance that a child attends on the day and parental consent or parental guardian consent hasn't been given, then every effort will be made to contact the parent or guardian that day to achieve consent. Failing that, a conversation will be had with the young person to assess their maturity to make that decision. But really, every effort is made to involve the parent or guardian in that decision. The second and probably more important question is, why should we be vaccinating our kids? And actually, the key thing to say here is, look, on the whole, yes, young people are low risk, and that feels, a really reassuring thing. As a parent, it's reassuring. However, that's not a no risk situation, and that's particularly around the potential for ongoing conditions like long COVID if your child was to catch COVID. The other thing to say about it is absolutely it's about preventing the spread of COVID within our communities, within our families, within our homes, with our families and our friends. And by vaccinating our children, we're also protecting ourselves and we're protecting the community around us and around them. Thanks.
Thank you very much, Caroline. And I think, you've covered really two important points which are at the heart of what parents and guardians of children want to know. They want to know how will they be involved in this decision making, in this consenting process. And I think the key point that I'm taking away from this is very much around supporting conversations to happen. I think at the point where you become aware that your child is being invited for the vaccination, have the conversation with your child, look at the information that's available, and be able to come to a decision that's right for your child. And obviously the second point that you picked is, why are we doing this in the first place? And I think it's become quite apparent if you look at how COVID has been spreading, through the population, that all those groups where we've seen very high rates of vaccination have really good levels of protection now, not just against infection or symptomatic infection, but also very high levels of protection against the risk of becoming seriously unwell, needing a hospital admission, and a very, very significant effect in reducing the risk of dying. And I think what this is more about now is trying to protect the population as a whole. Obviously, there will be some children who are at risk as well, but it's about protecting the whole population and trying to reduce that risk of disruption for children at school, which, I'm sure we've all witnessed. So thank you very much. Our last and final speaker, before we go into the QA, is Sadina Agama. Sadina, you're going to tell us about the safety of the vaccine that is currently in use. What can you tell us?
Hello, everybody. Yes, my name is Sadina. I'm one of the chief pharmacists for South West London. The safety of the vaccine. So as a pharmacist, this is the commonest question that I get asked. And I often say to people that I've been a pharmacist for over 30 years, and I've never come across a product that has been studied as much as this vaccine. And I've worked in clinical trials, I've worked in intensive care, I've worked with lots of specialist medicines. This vaccine is very closely monitored, and what that means is day by day we learn more and more about the safety of the vaccine. And from what we can see, the vaccine is very safe. After you've had the vaccine, you would have the normal post-vaccine side effects like a bit of a temperature, feeling a bit fluey, headache, fever, all of which are normally resolved within 24 to 48 hours, and for which you can take paracetamol. So we know that the vaccine is safe. It's been used in millions of people, both those that took the vaccine in the clinical trial phase, but also now the real life data that has come from all the vaccinations being done across the world. And now all the vaccines go through a very rigorous testing regime in every country where the vaccine is used. And our regulatory authority, the Medicine and Healthcare Products Regulatory Agency, has monitored this vaccine and is looking at how we react to the vaccine and records and looks at the trends. And all that information is telling us that this vaccine is very safe.
Thank you very much, Sadina. So there you've heard it from Sadina. She said to us that she can't think of a vaccine that's been studied ever more so than the current COVID vaccines that we have in use. And personally, I find that reassuring. Is it also fair to say, Sadina, that because actually other countries were ahead of the United Kingdom in terms of starting to vaccinate younger cohorts of children, so actually we're in an advantageous position in terms of having gone after some of those countries, because we can now benefit from some of the information and the studies that they've conducted?
That is absolutely true. So yes, there were countries like Israel and the United States that vaccinated their young children before the UK started. So from the experience that they've had, we know that the vaccine has been safe in the children when they vaccinated them. But the information is collated from all across the world. So it's a very, very rich data source with a lot of information, and it gives us a lot of assurance of the safety of the vaccine.
Thank you. So we're now going into our question and answer section. Thank you very much for being patient whilst you've been listening to the information around the program, how it runs, the consenting process and the safety. So we're going to start working our way through the questions in the Q&A, but please keep your questions coming as we're going through this. So the first question that I have is from Fiona. Fiona says, I have a 12-year-old son with celiac disease. What research has been done in this area with regards to issues that may arise if someone with such an autoimmune disease has the vaccination? Also, any evidence of issues with fertility connected to the vaccine? So we've got a couple of questions in there. The first one is around safety for a child with celiac disease or an autoimmune condition, and then the second one is around fertility. Shall I start maybe with Dr. Caroline Scott on that one, and then we can see if any of the other panel members want to add?
Thanks for your question, Fiona, and I can imagine that if you have a child who is living with a chronic condition, absolutely you'll have lots of questions specifically around that. I would be enormously reassuring that the vaccine has been given to thousands of patients now with autoimmune conditions, including celiac, and there's been no evidence of any concerns around vaccination in that population. Your second question around the question around fertility, again, it's an area that's being closely monitored, and at the moment we're seeing no evidence coming out connecting any fertility problems to the vaccine. That's been really highly publicised by the Royal College of Obstetrics and Gynecology, or people who are really interested in fertility, as I would describe them, and they've been very keen to make that clear. They've also made it really clear that actually one of the populations that we most worry about is our pregnant women, actually, and so even more important that population are being vaccinated.
Thank you very much for that answer. And is there anything in general that you would recommend, if there are people with particular conditions, maybe they're a little bit unsure about the vaccine, what would you recommend?
In terms of if people have questions related to a specific illness, so I think I'd always encourage you to talk to a health professional about it. Now that might be your own GP. There is also on the information coming out around this vaccination programme, there are also contact details for the community provider of this service, and they would also be a great place to start with questions.
Thank you, that's brilliant. So our next question is
You're on mute, Shannon.
Thank you, apologies for that. We have our next question, which comes from Lucy. And Lucy said, our children's grandparents live in Canada and it's been 2 years since we saw them. We cannot travel there because the kids are over 12 years old, but are not double vaccinated. Why can't they be given the option to have a double dose? Their cousins who live in France and who are the same age have had 2 doses and are able to travel to see them. So I think this is a question for our director of the vaccination programs, Una.
Thank you. At the moment, the JCVI have recommended 1 dose for this cohort, and so we are not in a position to offer 2 doses. As it already has been said, the programme is changing and more is being learnt as we go along, but the rules are clear at the moment. It's 1 dose only for this cohort.
Thank you very much, Una. That's a very clear answer. Our next question comes from Pallavi. Are the 12 to 15-year-olds eligible only for a single shot? Why is there discrepancy in the dosage instructions between various countries? So I think this is the question that we've probably just answered. So I think we've already answered this question. But can we? Is it worth just maybe exploring, because I think there's sort of different decision making and criteria in different countries, isn't there? And I think sometimes as the evidence is emerging or changing, or there's more vaccine in the supply chain, then it is a possibility that additional cohorts or additional doses may be looked at. Obviously, initially we didn't have a booster vaccine, for example, and we didn't have a second dose for the 16 to 17s, but actually now we've got a booster dose and we've got a second dose for the 16 to 17-year-olds.
Yeah, I mean, I would just add to that, the guidance is changing all the time. The JCVI are considering what other countries are doing and the evidence that's coming forth. So I have no doubt that this second dose issue for this cohort is an active consideration for those who are looking at decisions in this area. But it's just, unfortunately, as of today, we've got a very clear line and we can only operate in that way.
Thank you very much. So I think it's more that is the guidance that we have currently, but watch this space for more details. Now, one of the questions that we've received previously was around whether a child can a child who has allergies receive vaccination, and I just wondered whether our panelists would like to comment on that one. Maybe Caroline and then Sadina.
Thanks, Shannon. The short answer here is the vast majority of people can receive this vaccine with no concerns at all. There are a very, very small number of people who, in very specific allergy circumstances, i.e. where they have had a previous anaphylactic reaction to an ingredient of this vaccine, who cannot receive the vaccine. But as I said, it's a very, very small number. However, if it is something that you have concerns about, again, I would really encourage you to talk to a health professional to seek reassurance on that front. But I'd be strongly reassuring that there are no nuts in the vaccine, there is no penicillin in the vaccine. The sort of more common allergies I think that most of us are familiar with in our children are not ones that would present a problem here. So, Dina, I don't know if you've got anything to add.
No, you're absolutely right. So I work in many of the vaccination clinics. It's a very common question, and we would generally go through the patient's known allergens with them, and we've not come across one yet who's actually allergic to something in the vaccine. In Merton, we've been vaccinating since December, so that's thousands and thousands of patients, and we've not come across one. There are some patients, but they're a very, very tiny group of patients.
Thank you. That's really reassuring. Now, just linked to the question that we received previously around, whether children can have a second dose, there are some parents who are asking, their child is just heading towards the age of 12. They're 11 and a half plus, nearly there, and they also want the vaccine. Can you tell us what the sort of current guidance is around that? And will children who are just shy of 12, would they be considered for the vaccine? Maybe Una, you can comment on that.
Yeah. Again, to be fair to everybody, we have to apply the rules really fairly to everyone. So the child has to be between the ages of 12 and 15 to receive this vaccine. Now, clearly, if it's the day before the 12th birthday, we would be absolutely pragmatic. But other than that, we do have to stick within the guidance that the government has published.
And maybe if I can just stretch that question a little bit, Una, if there is a situation where at the point of invitation, a child hasn't yet turned 12, will there be an offer at a future point in time when that child does turn 12, say, you know, it's several months down the line, do they then become eligible?
Absolutely. I think this programme is going to run for some time, and the evergreen offer, as in the offer of a first vaccination, will absolutely be available to everybody, including this cohort. So for as long as this programme is running, if there are children that are turning of 12 years of age, then we would absolutely welcome them for vaccination in the ways that I referred to earlier, through maybe walking in to a mass vaccination site or dialing 119.
Thank you. That's really clear. Now, a couple of questions that we have received previously were from parents around, you know, what happens at the point when the child is being given the vaccine, they're actually getting the jab. If they're a little bit anxious, can a parent attend to a school to support them with that? And you know, what is the sort of aftercare just after a child has had the vaccine? So maybe a two-part question there. Maybe Una, if you're able to pick up the first one, and then Caroline the second one.
Absolutely. So this question has come up in a few of the webinars that we've had across South West London. Can a parent attend with the child at school? Unfortunately, there is not the capacity at school to allow that to happen, given the numbers of children in this cohort. However, that is why we created the secondary offer. And the secondary offer, where you can walk into a mass vaccination site with your child, where we have specific clinics that are just for children over a range of days and at the weekend as well. So we're hoping that there is a convenient time for any parents who would like to be with their child, you know, at the time of this vaccination. So not at the school, but certainly there are other ways of doing that.
Thank you, and it's really great that, you know, we've got several options that are available for families and children now in terms of the vaccination. But how about the aftercare? What happens with these children when they've just had that jab?
So probably really important just to think through the process of vaccination first of all. So I'm sure lots of people on this call will have had their own vaccine and will be familiar with the fact that it is a small needle inserted into the top of your arm. I think really important to talk to kids about that process, about what it involves, to be very reassuring to them about it, actually, that whilst it is, you know, uncomfortable, I think most of us would agree it's not an unmanageable discomfort. In terms of the programme, so very similar to other vaccination programmes in schools, so it's being provided by the community healthcare providers who are trained health professionals who have got a lot of experience in vaccinating young people and are really aware of some of the issues that can come up. As with anyone receiving the Pfizer vaccine, all the children will be monitored for at least 15 minutes afterwards to make sure that they feel well. Although I'd actually, again, be really reassuring that the very, very tiny number of people who experience a problem after the vaccine will experience it very rapidly. So that 15 minutes is a very generous time period to monitor people for. If the children have any problems following the vaccination, again, those health professionals are there to support them. Obviously, if they continue to be unwell enough that they can't remain in school, then parents and guardians will be contacted to come and collect them. And so we're really encouraging people to be aware of when their children are having the vaccine.
That's brilliant. So there you have it. There are a couple of options. If you're concerned and you want to provide more support for your child, then you can go with them into one of the walk-in centres. But equally, we're reassured that we've got very experienced people providing the jabs to the children in the schools, you know, who perform this role, and they deliver other jabs as well. So the children are in really safe hands. So I think we're probably coming towards the end of our questions, and I've got just a couple more questions before we start to draw to a close, if I haven't received any more. The next question we have is, there is a lot of reasons on social media advising against the vaccine. My family and friends don't recommend my children to be vaccinated. Why should I? So that's an interesting question. I don't know, again, Caroline, if you want to take that one.
I can certainly give it a go. So the question was, you know, my family and friends say that they don't think I should do it. why should I do it? And it's so difficult, isn't it? Because we're all really influenced by the people around us and the decisions that they make. But ultimately, as you know, as responsible parents, guardians of these children, actually, it's really important that we are making the decision that we feel is right for them, that we're making it as a really informed decision. I think the fact that you've attended this webinar speaks volumes about you, actually, that you're really interested in knowing this. And I guess what you're hearing here is a panel of experts saying, look, we would strongly encourage you to vaccinate your children. You're doing it for their benefit. You're doing it for your benefit. You're doing it for everyone's benefit. And I suppose that's what I would say back to the family or friends who are perhaps a bit nervous. Maybe challenge them to come to the next of these webinars, and maybe we can answer some of their worries.
Thank you, Caroline. I think the other thing that I would add as well is there can be a lot of information going around on social media, and sometimes you don't really have any certainty around whether it's coming from a reputable source and whether it's coming from a reliable or knowledgeable source. So I think the question around challenging some of that is really important, but also there are a lot of resources on the CCG website, on NHS Choices and on .gov, where you can get information firsthand for yourself that will inform you to make the appropriate or the right decisions. So the last question that I'm going to ask is one that has been asked around the NHS Pass. And the question goes, will the vaccination for 12 to 15-year-olds now be included on the NHS Pass that acts as proof of vaccination when traveling abroad? Yes, a really good question ahead of the sort of festive season when some people might wish to travel.
Shall I take that
would
one?
you?
Yeah.
Yes, thank you.
Yeah, sure. At the moment, children under the age of 18 do not need to provide evidence of the vaccine. However, that's for this country. And I know there are different rules and regulations for other countries where vaccination status is required. The development of the NHS Pass is a technical group that are leading that, and I know it is part of their debate. This issue has been consistently raised that we need to find a way for this young cohort to prove that they have been vaccinated. So as of today, no is the answer, but I do believe that it's under development.
Thank you, Una. So that's reassuring. That's already been thought of by the great and the good. They're looking at it and trying to make that happen for people.
There's two questions in the chat, Shannon. There's
Thank
two.
you. Yes, I do apologize. We're still in business this evening, and we've got a question from Kate, which says, will the vaccination for 12 to 15-year-olds now? Oh, okay, so that's just been answered. The other question is, what reassurance can you give us about the long-term effects of the vaccine being given to children during adolescence when their bodies are going through so many substantial changes? I think that's going to be a combination of our experts, Sadina, and then maybe Caroline, you might want to say something as well.
Yeah, thank you for your question, Kate. And we talked about some side effects of the vaccine earlier. And the thing that we said was that this vaccine is the most studied vaccine that I've certainly seen, and I've been a pharmacist for over 30 years. It is closely monitored, and we in the UK introduced our children's program after two other countries, or at least two other countries. So the United States has started immunizing their young ones, and so had Israel. And from the information that we got from them, they had no reason to believe that this vaccine wasn't safe for their children. So those children have been monitored. The thing to note also is that vaccines are quite different to medicines, and that if there is going to be a problem with the vaccine, you would know it within months of using the vaccine. We've been using this vaccine now for 2 years plus, because remember, there were people that were in the trials also before we started to use it. So there is a lot of information on it, and there's no information that gives us any reason to believe that it is a problem for our younger children.
Thank you. That's really reassuring. And another point that sometimes I forget, actually, that before the vaccine started to be given to large groups of the population, and hundreds of millions of people across the world have had the vaccines now, actually there were some studies that that took place, again involving thousands of people before the vaccines could even be approved for wider use. So thank you very much for that. So I think we've come to the point where we've answered all the questions, most of the questions that we've received this evening. As I say, it may not be possible for us to answer all the questions, but what we will do is certainly look into any of the questions that we haven't been able to address this evening and ensure that the Q&As on the South West London CCG website are updated. And again, you know, in terms of where you can access the vaccine and what opportunities are available, I strongly encourage you to go onto that website, South West London CCG, because it is updated regularly and has lots and lots of helpful, useful information on the vaccines. So it now just remains for me to thank you so much for being attentive, for taking the time on an evening to participate in the discussion and to ask the questions. I certainly hope for those questions that we've asked, we've left people with a little bit more information than you had before, and maybe you're feeling more confident now in terms of whatever decision it is that you will be making with your child about the vaccine. So in terms of the next steps and what you can expect, if you haven't already had an invitation, what you can expect is that you will receive a letter, probably via email, from your child's school. It will include a consent form or a link to an electronic consent form. It's really important that you make sure you complete that form by the deadline given, so that you know, the people who are going to the school to deliver the vaccinations know that you have consented and they're ready and they're there to offer that jab to your child. Obviously, as we mentioned, if you do prefer, you can go with your child to one of the walk-in centres, and there's a list of available walk-in centres all across Southwest London where you can go with the child, or the young person can go to. And again, those are listed on the CCG website. And just finally, if you have any further questions, you can find the answers on the CCG website. And as I said, this session was recorded and will be also published on the websites for those who were not able to join this evening. So thank you very much to our panel members. I also just really want to thank several people who are working behind the scenes. We've got our moderators, Dom Ridley-Moy and Simon Wadey, and we've also got our producers, Aman Nathan and Jiggy Trivedi Gardner, who've been working tirelessly to plan this webinar tonight, and they're still working on it in the background. Thank you to them, thank you to everyone, and good night.
Good night.
Thank you, Shannon.